Over 2,000 years ago, Hippocrates was describing patients with a quickened response to sensory experiences, but less tenacity. In 1980, we officiated that condition as ADHD, or attention deficit hyperactive disorder. Today, this is understood as a neurodevelopmental issue with three different presentations. You have primarily inattentive, which is the AD, predominantly hyperactive/impulsive, which is the HD, and then you have the combined presentations. So how do you get diagnosed with any of this? You need to have at least 5 symptoms as an adult, or 6 if you're a child. And these symptoms have to manifest in at least 2 different environments: school, work, home, and the symptoms have to have appeared before the age of 12. It's not about a lack of intelligence or ability or anything of the sort, but rather a higher need for stimulus in order to maintain attention. You have Sir Richard Branson, Tom Holland, Simone Biles, Michael Phelps, and even little old me, who all have ADHD. In fact, ADHD has been correlated with an increased level of creativity and entrepreneurship, which makes sense because your mind is constantly flowering with thoughts. Neurobiologically, ADHD looks like dysregulation of dopamine in the prefrontal cortex and the frontostriatal circuits, which is an area responsible for inhibition and sustained attention and things of that sort. Though CBT, or cognitive behavioral therapy, is an evidence-backed treatment, the real gold standard is medications that work on that dopaminergic and norepinephrine pathways, like Vyvanse, Concerta, Ritalin, Adderall. And there's also the non-stimulant alternative like Strattera, which I've taken for about 25 years.